The following segment on Eyewitness News is sponsored by Living Well.
Welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. How are you, Dr. Chapman?
I'm still living well.
Well, that is great to hear. So today we're going to kind of conclude a three-part discussion of different ways that Juvederm products can help us. We've talked about the mid-face area and under the eyes. Last week we talked about the jawline. Today we're going to talk about the temple area.
That's correct.
And this is all in preparation of what is coming up tomorrow, which is
Right.
actually Juvederm Day.
That's correct. We're all excited about it. So, everything has its day now.
Right?
But I mean, we're excited for Juviderm Day and for, the benefits that the patients can receive from these hyaluronic acid gels. And also in celebration of Juviderm Day tomorrow, obviously we'll be having a special that the patients can actually, if they book tomorrow or anytime the rest of the week, they'll receive in celebration of this, and they can call the office and ask what that is. But what I wanted to do today was focus on Voluma, Juvederm Voluma XC in the temples. It received the
Okay.
indication almost a year ago. I think in September of 2024, we finally launched Juvederm Voluma for treatment of temporal hollowing or temporal wasting. And basically, we see a lot of this today because everyone is using the GLP-1s to lose weight, and
Right.
it does cause rapid weight loss or rapid loss of fat in the face. And so we're seeing a lot of hollowing in these
Mhm.
areas.
Mhm.
It's not necessarily an area that people come in and go, "Oh, I'm getting hollow in my temples. Will you fill
Right.
them?" They'll come in and ask about their cheeks. They'll come in and ask about their nasolabial folds, but they don't see what's going on here. And basically, in this area, we have multiple layers of fat. And as we start to lose weight or as we age, this fat starts to decrease in volume, and we see a sinking in of the temple region, which makes us look unhealthy. It also causes the brows to lower.
Oh, never
Um,
thought about that.
by
Okay.
focusing on restoration of volume in this area, appropriate volume restoration, you get a very, very healthy look to the patient. And so that's when I'm talking to patients in their consult. That's one of the things I talk about is how this injection, and it's usually in my practice, a single injection in the anterior superior temporal fossa, which is this little area right here. Um,
Mhm.
that injection point can make the patient look the healthiest of pretty much all the injections that I do. And so they do get a little bit of lateral lift on the side of the face. They also get a lift on the brow, and that is instant. Like literally, I treat one side, pick the mirror up and show them, and they literally have a natural brow lift from the restoration of volume there.
Wow.
Lasts about a year or more, up to a year. It is very, very it's one of the simplest injection points to do. I mean, it takes me about 30 seconds to treat this area with Voluma. We choose the area that we inject in because it's one of the safest areas to inject the temple. We do a specific procedure in this practice to keep the patient very safe, because I know when patients go out there and they start searching and they start looking at temple volume replacement, they're going to see different things. It's all how it's done, and it's all the amount that's used that keeps the patient safest. And that's one of the things we focus on here is safety.
Sure.
So the technique that we do, I feel, is very safe for the patient and accomplishes what I need it to accomplish, which is that lateral lift and that lift on that brow and a healthy restoration to the face. So Voluma is amazing. We talked about it in the jaws, in the cheeks. It's indicated for temples, and it's also indicated for the chin as well. And we mentioned chin briefly last week as we were going off the air that
Right.
people need chins. So when you're coming in, I think the basic analysis, if you're 50 and above, you need to be looking at temple volume, mid-face volume, and projection of chin and how those relate to each other, and then as well as jawline. And the Juvederm portfolio addresses every one of those areas on label, per the FDA. So really one of the only collection of fillers that can boast over 91% of the face on label per the FDA's guidelines. And so that is huge because that means there were lots of studies done that proved safety of the product and proved the efficacy of the product. So that's why we celebrate tomorrow, Juvederm Day, and are excited to bring it to the Charleston and Huntington area. And again, I love temples, how they make the patient look healthy. And that's the recap that I want to focus on is that healthy injection, temple region. We want this to be either slightly concaved or slightly even in a male. That's for a female. In a male, we want it either even or just slightly convex. And that's the
Okay.
differences between the
That's
male and
interesting.
female anatomy. Yeah.
Oh, wow.
So,
All
yeah,
right. Learn something new every day. All
that's
right.
right.
Well, thank you so much for being with us and sharing the information, Dr. Chapman.
Oh, thank you for having me, Shay.